Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Rakta Srotas Vyadhi and we have started with the Rakta Pitta as a disease. And in that regards, I have explained you what the meaning of Sammurchana exactly means. So, Sammurchana means two or more substances come together and form a totally different or abnormal substance in the body and it is called as Sammurchana, and hence Rakta and Pitta in normal Swastha Avastha they are working together homogeneously, but when the Sammurchana takes place their combination turns into a different substance which is causing trouble to the body and creating Rakta Pitta. Let us revise the Sampratya of Rakta Pitta again because it is very important to see the Samprapti for treatment part of by treatment on the treatment part of view also. So what is the main? It is Pitta Prakopak Hetu, mainly of Tishna and Ushna Guna. Then it becomes because of Hetu Pitta Prakop, and as a Dushya there is Rakta Dushti. Next step, as one of the Guna in the Hetu is Ushna Guna, it is Svedana Ushnaha. By this law there is this increased Ushna Guna creates Svedan of Dhatus. I have explained what is Svedan. Svedan means outflow of the water from any ashay or srotas towards the outside direction. It crosses the border of the ashay and gets outwarded. So, Svedan does not mean only sweating, but it is the outflow of the water from any ashay or srotas towards the outward direction of that ashay. So, because of dhatu Svedan, the Dravamsh which is present in the dhatu starts exiting from that dhatu srotas or ashay, and it starts getting accumulated in the Raktavah Sira. Now this increased Jalamsh of Raktavah Sira creates increase in the volume of the blood in the Sira. Up to certain level, the Sira try to occupy or accumulate this increased Dravamsh, but at a certain stage their capacity gets ended, and this internal pressure of the Dravamsh, because of this internal pressure of the increased volume of the Dravamsh, they start to break up. For this breakup, Tishna Guna which is present in the Hetu, Pitta Prakapa Hetu, by the rule Bhedane Tishna also helps, and this Tishna Guna also because of adds to this breaking of the Raktava Sira. The Sira get breakdown and there is a Rakta Srav, or what we call as Rakta Pitta. Any bleeding from the orifice without external trauma is Rakta Pitta. So this is a Samprapti. In short, I have revised it. In this Samprapti, there are two interesting things which are additionally explained by the Granthakar. First is, this Samprapti happens in the body at that time as Yakrut and Pliha are Moolasthana of Raktava Srotas. There is increase of the blood or Rakta Vruddhi in the Yakrut and Pliha. This is a very important phenomenon, happens side by side during all this process. There is Rakta Vruddhi in the Yakrut and Pliha. And second interesting thing which they have described about this Vyadhi, all of you know that this Vyadhi is Mahavegam Mahaghoram Ashukari. It is Mahavegam Mahaghoram Ashukari, means it is very fastly developing disease. Then it has got tremendous Vegavastha or the intensity, and Mahaghoram, the patient can be serious at any time. Now remember this samprapti which I have explained to you, and also keep it in mind these two factors. Okay, now we will move towards our regular clinical experience. This is summer season, you know, there is very hot temperature all over India, and in this season you will find many patients with nasal bleeding because of increased heat, or many times because of this hetu sevan you will find that people complain of sarat mala pravrutti or even mutra pravrutti also. Now patient comes to you with, for example, nasal bleeding. We ask the hetu parivarjan, etc., etc. But in all this treatment, patient is frightened because of bleeding, no doubt. But we give the medicines, anything for the like Durvasaras or Shitavirya Stamban Dravya to stop the bleeding. But we never find, or most of the times it is curable within 2-3 days. Even ice pack application will also helps in the regular practice. Okay. Same we think with the Sarata Mutra Pravrutti or even Mala Pravrutti. Always remember, whenever there is bleeding and when I am telling you that this is Ratta Pitta, diagnosing you are diagnosing it as a Ratta Pitta, always remember only bleeding symptom is not enough. You have to rule out the cause behind the bleeding. For example, a patient comes to you with a Saratta Mala Pravrutti, you have to find whether it is Saratta Arsha, Parikartika, ulcerative colitis, or Pravahika, etc. When there is Saratta Mutra Pravrutti, you have to diagnose whether it is because of Ashmari or any other pathology happened in the Mutra Srotas. When there is Saratta Steven, always remember whether it is because of some gum problem or some lung samprapti in the because of some tear, etc., etc. In the Nasaga Tattasrav, you have to check out whether it is Nasarsha or any other, or it is any other thing in the happening. So always remember, if you find a cause that there is because of Arsha, because of Parikartika, like that, then in that case the Rattastrav is a symptom and is not a disease as Rattapitta. Rattapitta is the disease when there is bleeding without any other causative factor or disease present in the body. Now, Mahavegam, Mahaghoram, Ashukari is the Varnan. But when a patient comes to you in this season with nasal bleeding, do you find it is Mahavegam? Do you find it is Ashukari? Yes, because Rattam Javidesi, you have to stop the bleeding as early as possible. But is it Mahaghoram? No. A patient comes to you with Sarta Mala Pravrutti and he says that at the time of motion only I get the bleeding, either before or after with the fecal matter. But yes, the patient gets frightened, you have to stop the bleeding, no doubt. But is it Mahaghoram, Ashukari, Mahavegam, and does patient land into any critical condition by these types of bleeding? No. So, if there is a nasal bleeding, for example, without any internal other disease like Nasarasha, etc., it is purely Ratta Pitta, Urdhagata Ratta Pitta. But patient doesn't seem to be going to be a serious because of that blood loss, or it is no other symptom Mahaghoram, then this is Ratta Pitta, Nasarat Rattasrav. You will stop, we will take the treatment in the next lecture. But it is not Ashukari, it is not Mahaghora. Ashukari may be present because of heat, but it is not Mahaghora at all. Then my question or homework to you, why they have mentioned the disease Mahavegam, Mahaghoram, Ashukari, and in which condition we see these words meaning, in which condition we see that it is Mahagorum Ashukari Mahavegam. Homework for you. We will discuss this in the next lecture. Thank you very much.